Good day everyone, my name is Carmela Pacle, a third-year nursing student from University of Eastern Philippines. In this video, I am joined by Miss Jendell Depin, and together we are going to discuss the deep vein thrombosis or DVT. To start, Miss Depin will first explain what a venous thrombosis is, so we can better understand the basics before diving deeper into the topic.
Good day everyone, I am Jendell Depin from Section B. So first, what is venous thrombosis? Venous thrombosis refers to the formation of a thrombus or a blood clot within a vein, which can partially or completely block blood flow. It commonly occurs in the deep veins of the legs, or a condition known as deep vein thrombosis. So we have here an illustration wherein the left side shows a normal vein where blood cells flow freely within a smooth, unobstructed vessel, while the right side depicts a vein affected by thrombosis. A cluster of red blood cells is visible, indicating a blood clot that blocks or reduces blood flow.
Now that we have covered the general idea of venous thrombosis, let us talk specifically about deep vein thrombosis. So deep vein thrombosis refers to the formation of thrombus or blood clot in the deep veins of the body. It most commonly occurs in the thigh or calf, but it can also happen in the arm or other areas of the body. The veins most at risk for DVT include those in the pelvis, lower legs, and thighs, particularly the peroneal and posterior tibial veins, which are located in the calves or can be found in the lower leg. We also have the popliteal and superficial femoral veins, which can be found in our thighs. Now that we understand what DVT is and where it commonly occurs, let us explore the pathophysiology and learn how DVT develops. We'll start by discussing the risk factors, which are divided into two categories: the modifiable and non-modifiable. These factors are color-coded based on their relation to the virtuous triad, which we will tackle later on. First, let us look at the modifiable factors. These are risks that you can change or manage to reduce your chance of developing DVT. So we have the immobility, or the lack of movement, such as after surgery or having long trips. So this slows down the blood flow, leading to the venous stasis. And we have the obesity, so extra weight puts pressure on the veins, reducing the blood flow. And then we have sedentary lifestyle, so not moving enough contributes to slow blood flow. And then we have smoking. Smoking damages blood vessels, increasing the clot risk. And then we also have the trauma or surgery, which can damage blood vessels and trigger the clot formation. Next, we have the non-modifiable factors, which are risks that you cannot change but should still be aware of. So we have the paralysis or stroke. These cause immobility, leading to venous stasis. And then we have the older age. So the veins become less elastic as we age, increasing the risk of clots. And then we have previous DVT. A history of DVT increases the chances of developing it again. And then we have pregnancy. So the hormonal changes during pregnancy and the pressure on the veins make the blood more likely to clot. And then we have genetic disorders. So conditions like factor V Leiden increase the tendency for clotting. And lastly, we have the cancer. So some tumors release substances that can trigger blood clotting. Now let us proceed to the disease mechanism. So DVT forms due to the interaction of the virtuous triad, which consists of venous stasis, hypercoagulability, and endothelial injury. So venous stasis is when blood flow slows down, especially in the deep veins of the legs. This occurs when someone is immobile for a long time, like during bed rest, during the long flights or travels, or sitting for hours. When blood isn't moving well, it becomes more prone to clotting because the natural flow of blood usually helps prevent clots from forming. we have the hypercoagulability. So increased clotting tendency, such as due to pregnancy, cancer, or genetics. So this leads to faster clot formation. And lastly, we have endothelial injury. This is when the blood vessel walls become damaged due to trauma, surgery, or other factors like inflammation. So when the blood vessel wall is injured, platelet activation and adhesion occur. This means that platelets stick to the damaged area and release signals that activate the clotting factors, which will lead us to the coagulation cascade activation. This is the body's way of stopping bleeding and forming a blood clot when needed. It involves a series of steps where proteins, called clotting factors, work together like dominoes. One activates the next, and so on. So the coagulation cascade has three pathways, which are the extrinsic, intrinsic, and common pathways. So the extrinsic pathway starts when there is a damage to the blood vessel walls or blood vessel tissues. So when tissue outside the blood vessel is injured, it releases a substance called tissue factor or TF. TF triggers the activation of factor 7, which then activates the factor 10. This is the quickest pathway because it starts directly at the site of injury and leads to clotting fast. So the next pathway that we have is the intrinsic pathway. This is when there is a damage or irritation inside the blood vessel, such as when there is a venous stasis or inflammation. This pathway begins when blood comes in contact with something unusual, like exposed collagen in a damaged blood vessel. So when there is a surface contact, there is an activation of factor 12, which then activates factor 11 and so on until it eventually activates factor 10. This pathway is slower but still amplifies the clotting process. And then lastly, we have the common pathway. So both extrinsic and intrinsic pathway eventually lead to the activation of factor 10. Factor 10 is like the gateway to the actual formation of the clot. So in the common pathway, we have the activated factor X, which teams up with the factor 5 to convert the prothrombin into thrombin. So thrombin is the key enzyme or an important enzyme which turns the fibrinogen into fibrin. So the fibrin is like a mesh-like structure or a sticky net that traps the red blood cells and the platelets, creating a stable clot or the thrombus formation. So once the thrombus forms in a deep vein, it partially or completely blocks the blood flow through that vein. This is what we call the venous obstruction. The clot acts like a dam, stopping the normal blood flow back to the heart. And from venous obstruction, the clot can either propagate or grow larger as more platelets and fibrin get added to it, or it can embolize or break off and travel through that bloodstream. So if DVT is not treated, the following complications can happen. First, we have venous insufficiency and local damage. This is when the veins in the legs cannot effectively return the blood back to the heart due to the damaged valves in the veins caused by venous obstruction. So as a result, blood flows backward and pools in the veins, causing a local damage or the swelling and skin changes. Next, we have a complication called pulmonary embolism. This is when a piece of clot can break off and travel to the lungs, blocking the blood flow, which can be life-threatening. Next, we have the ulcer formation, which is caused by poor circulation. So poor circulation due to clots can cause wounds that are hard to heal. Poor circulation means that oxygen and nutrients cannot reach the skin and underlying tissues properly. Without enough oxygen, the tissues break down over time, leading to the venous ulcers. Next, we have the stroke, which is a rare but possible complication if a clot travels through an abnormal heart connection, such as an atrial septal defect. So the clot can bypass the lungs by traveling directly from the right side of the heart to the left side. From there, the clot can travel to the brain, blocking the blood flow and causing a stroke. And lastly, we have the suppurative thrombophlebitis. This is when a blood clot becomes infected, causing inflammation of the vein and the surrounding tissues.
Signs and symptoms of deep vein thrombosis includes swelling, cramping pain, redness, warmth, hard and sore vein, larger calf diameter, and Human sign. And Human sign, it is a pain or discomfort in the calf muscles when the foot is dorsiflex while the knee is straight. For a diagnostic test, we have here medical history and physical examination. Next is Well score, which is a clinical tool that helps doctors determine a patient's risk for developing a deep vein thrombosis and pulmonary embolism. Wherein pag high and probability, we uses ultrasound. So this test uses sound waves to check the blood flow in your veins. Wherein pag low man and probability, they uses D-dimer test, which is a blood test that measures the amount of D-dimer or a protein produced by the body to break down blood clots. Another one is venography. So for this test, a dye is injected into your veins. Then x-rays are taken to show blood flow and look for clots. So the purpose of dye is to make your veins easier to see on the x-rays. Last is the MRI, MRA, or CT. So the imaging procedure that will be used will depend on the type of blood clot you have and where it is located. For nursing management, we have here DVT clot, wherein the D stands for don't dislodge the clot, don't massage to prevent dislodging the blood clot, which could travel to the lungs and cause a life-threatening pulmonary embolism. Don't poke to avoid increasing blood flow and pressure, which could dislodge the clot and lead to pulmonary embolism. And don't apply heat to prevent increased blood flow and vessel dilation, which could also dislodge the clot and lead to pulmonary embolism. Then V stands for elevate vein issue above the level of the heart to improve circulation and decrease swelling. For T, anticoagulants to terminate a clot. Then C, compress, warm, and moist to alleviate pain and reduce swelling by promoting local blood flow without significant risk of dislodging the clot. And L for leg circumference measurement to help detect swelling or asymmetry, which may indicate the presence of a blood clot. Then O stands for observe for signs and symptoms of or for pulmonary embolism. Then lastly, T stands for tight compression stockings to improve blood flow and reduce swelling. And lastly is the medical management, which includes vitamin K antagonist, indirect thrombin inhibitors, direct thrombin inhibitors, and factor Xa inhibitors. So vitamin K antagonists are a class of drugs that prevent blood clots by inhibiting vitamin K's function. Indirect thrombin inhibitors are a class of drugs that prevent thrombin from acting by activating natural thrombin inhibitors or by blocking coagulation factors, while direct thrombin inhibitors are types of anticoagulants that prevent blood clots by binding to thrombin and blocking its activity. And factor Xa inhibitors is a type of blood thinner that prevent blood clots from forming by blocking the activity of factor Xa, which is a blood clotting protein in the blood.